Dr. Shapiro, we get this question a lot. I'm sure you do too. A lot of patients with irritable bowel syndrome want to know, what can they eat? What's my nutrition plan? What do you usually tell your patients?
That's a very common question indeed that we get asked. There are patients who, as you alluded to, are sensitive to everything they eat, and there are patients who have already come with identified triggers for their symptoms. Many times, though, patients are unclear what's triggering their symptoms or if diet is actually impacting their symptoms at all. And it can be very helpful to engage the help of a registered dietitian to help to sort through what are the food triggers a patient is experiencing and how to expand the diet and give them more freedom over what they're eating. The other common thing that we see is significant anxiety around meal times, this fear of eating that often perpetuates and worsens symptoms. And then patients don't know on a given day, is what I ate the cause of my symptoms, or is it something else? And they're constantly fixated on meal time. So I see a lot of my patients with IBS when I ask them how much time they spend thinking about what they eat and how that might have impacted their symptoms. And it's far more than the average individual. So the help of a dietitian can include both taking a more detailed diet history than sometimes we're able to as physicians. And it can also be employing certain diets such as the low-FODMAP diet, which is one of the most common diets we use. And that's a diet, as a broad overview, that has 3 phases where they will help cut out certain foods that are more common triggers of IBS symptoms to see if you get better or not. If you do get better, then you go into the reintroduction phase, where they'll help you sort out what are the triggers within those foods that you cut out that might have been causing your symptoms, and then trying to personalize it in the final stage, again, to help patients have a more expansive and diverse diet. The last thing that I want to just highlight is that with any diet that might be trying to pull things out to see if those are triggering a patient's symptoms, it's really important to have a conversation with your healthcare provider. If you've ever had any form of an eating disorder or disordered eating, that includes things like anorexia nervosa, bulimia nervosa, binge eating disorder, those can be really sensitive conversations to have, but we want to make sure that if we do recommend a diet therapy, that we're not potentially putting someone at risk for tipping back into those disordered eating habits. And I think, similar to mood disorders and their link to IBS, that can be a really sensitive and scary conversation to have, but those are really, really common and not something that you need to be ashamed about, and can help us make sure that we're using diet therapy and IBS in a safe manner.